Hello, everyone. Today we're interviewing Kristen Stuppy. She's a pediatrician and she's also a committed partner of Find the ADHD Girls. And today we'll be finding out her story of how she learned about ADHD and herself and what she's doing in her professional life and how ADHD fits into that.
For years, I've followed Dr. Ursa Bauer on social media. I found her very creative. She had all kinds of fun handouts and obviously focused on ADHD. So really appreciated all the things she was doing. And then she came out with this really cool program that she originally, I think, had intended to do in person, but then COVID hit. She did online classes to teach kids and parents about ADHD. Then she opened it up to other pediatricians and asked if anybody else wanted to join her because she was getting busy with it. I started teaching with the Teach Me ADHD program a few years ago. Prior to that, I had been teaching a teen group for our local CHAD chapter in the Kansas City area. I did the ADHD KC teen group online. And so I had experience working with teens, teaching them much of the same topics. The first time I saw the courses that the Teach Me ADHD program offered, I was like, this is almost exactly what I'm doing. I didn't have the cute detective theme, but I was already teaching some of the same principles. So now we have the director's cut for teens and the Teach Me ADHD for the 8 to 12-year-olds.
Is there different things that you teach children, or do you present the same information in a different way?
The Teach Me ADHD original program for the 8 to 12-year-olds is taught to the kids with the parents. She starts with introducing what the brain is, how it works differently, and gets them to understand that they're not alone. It's not their fault, all these challenges that they have, and how to overcome those challenges. Everything from mindfulness to organization and planning skills and things like that. The courses that I help develop for the teens, very similar, but it's more for the teens themselves and not with the parents, because we want teens to be more independent. With the kid group, each week they focus on one skill. After that week session, then they have a week to work on their family mission and their, oh my goodness, I'm forgetting the term. Anyway, they have their deeds and their missions. So the kids have some deeds to work on and a family mission to work on. They reinforce the skills that they learned in their class over the next week at home. So it's an 8-week program, and she just extended it this year, something new. There is an ADHD coach who is working with parents alone on 2 separate sessions, so parents learn how to support their kids even better. With my class, they take one at a time. I had one teen who took 3 or 4 back-to-back each week for 4 weeks after each of the teen classes. I send an email to the parent. The teen has 4 weeks to work on certain things. They get a workbook or worksheets for the sessions that focus on the skills.
You and I both then think education is a huge piece of doing better with your ADD. It's nice to know about your program developed by physicians and successful with the parents.
For 20 years, I was a pediatrician. I would see them kids every 1 to 3 months to do their med checks, and we'd talk about how things are going. But when things weren't going well, all I could do is adjust medications. That's not always the thing that's needed. Sometimes they need the skills, and pills don't teach skills. As a parent of a child with ADHD, and attending CHAD chapter meetings, I would learn from different psychologists or social workers or nutritionists. I could bring bits and pieces to the clinic and suggest this might work. I've learned more and more, and that's how I started developing the teen program for the local CHAD chapter here. The kids need to hear this too. There's not enough time in a clinic visit that's set for a medication check. Physicians aren't generally trained to do all of the other things. I learned because I was the parent who had a child that needed these things. Most parents need to go somewhere to get that information.
You've been doing ADHD with children for over 20 years. You have a child with ADHD.
I knew that it came from genetics, but I also knew that my husband had ADHD, so I just figured my child caught it from her. I identify with a lot of these symptoms, but surely I don't have it because I'm a physician. I made it all the way through med school. I'm successful. My father and his father have dementia, so I wanted neuropsych testing. I went for the review with the neuropsychologist. Says, I don't see dementia, but have you ever considered ADHD? I almost started laughing. Of course I've considered it, because doesn't everybody think they have some symptoms of it? I think back to when I was a young child, my mother would yell at me because it would take me forever to write my thank you notes or to finish my homework. I procrastinate for a long time. because it's intimidating. And finally, when I do it, why did I worry about it so long? It took me 10 minutes. I have chosen so far to not do anything with the diagnosis. I've made it this far in my life. It would have really helped me when I was back in school or when my kids were young. I have all these supports in place. I am a list maker. If something's going to happen, it has to be written down. I can't remember things. I'm very fortunate because I figured out early on what I needed to do. When I read something that's boring, I take notes as I'm reading, or I stand and I pace in my room while I'm reading if it's boring. If I just sit there and read, I'm thinking about something else. I figured out how I can focus and pay attention. It's not an intelligence problem. A lot of parents think my kid can't have ADHD because they're too smart. It's totally not that. But if I can't focus on the reading, I'm not going to retain what I read. Then it will look like I am not smart enough to learn the information. When me as a pediatrician has parents fill out surveys, teachers fill out surveys, sometimes those surveys look normal. The questions that are asked aren't the right things. If you add up the answers, it looks like a neurotypical survey. But if you dig deeper and ask about how life is going and figure out what they're doing to have the normal appearing survey, I think that's huge. That's in part why so many people are missed with ADHD, even if they go for testing.
Screening doesn't get deep enough to get at the problems the child has with learning.
I'm in the camp that believes that ADHD diagnosis needs to change. The name needs to change. The criteria need to change. We've learned so much about how to support it and how to assess for it. The term is horrible. It's not an attention deficit. Your mind might wander, but you can focus for hours on things you like.
I think there's no one that would argue with you that we should, that it's good. What we have is good. But on the other hand, I get told, oh, you can't change the name because it's written into legislation for qualifying for the IEPs or whatever, the no child, I don't know, it's federal legislation, it's in there. And then also, I wonder, historically, have there been conditions that they're changed over time?
Yeah.
Give me an example.
ADHD has changed over time. For a while, it was ADD. In 1987, it became ADHD, inattentive
Yes,
versus.
that's true. It switched
Right.
to, yeah. So
Right.
So
Yeah.
we could work towards that then.
Yeah, they change names of things, not all the time, but historically, there is definitely a precedent.
Cautiously. So how many years ago was it that you got diagnosed?
Just within this past year. Again, I was going for dementia testing, so I was in my 50s.
It sounds, many women I talk to, there's a grieving period when they find out. But the way you present yourself, it sounds like you didn't miss a beat. You got the diagnosis, you said, oh yeah, that fits, and let's go on with life.
Yep, texted a friend, I get to join the cool kids club now. I feel like we tend to find each other, right?
Yes, that's true.
Yeah. Unfortunately, I feel like kids with ADHD often struggle in the social circles. When they're very young, they're popular because they're fun and they have energy.
The combined type.
Inattentive.
Yeah.
Because the hyperactive kids do get diagnosed early because they're bouncing all over the room and they're easily noticed.
I think of them as the fun types. And I think what you brought up in your essay is the inattentive. I was thinking you felt shy, and I think that relates more to the inattentive.
I definitely.
Because I think of the combined being the salespeople.
I can talk to people easily, but not like I'm not good in a crowd, things like that. Definitely not. And I feel like some of my shy that I attributed to as a high schooler was trained by myself because I would get in trouble if I spoke out of turn. So I knew that I wasn't supposed to speak. I'm very much a people pleaser. I want to be the good kid. I want to do what is expected of me. So I just stopped talking.
You mean spoke out of turn, you're meaning in class, you answered when you weren't supposed to?
I feel like when I was younger, I did that because I can remember little snippets of being told to stop or not do something. So I feel like I trained myself to not speak up or speak out.
Because for me, I was reflecting on the shyness part too. And even now, if I see someone I know in the grocery store, instead of going up to say hello, I'll try to prevent them from seeing me. I think mine was somewhat based on anxiety because I got prescribed doxepin for allergies. It has a very high antihistamine effect, but it's also a medicine prescribed for anxiety. And when I was taking Doxepin, I was talking to everyone.
So that does seem more like anxiety than ADHD, for sure.
Yeah, but it could be part of my ADD anxiety.
Most definitely. They're bidirectional. One causes the other and they lead into one another. Yeah.
Any stories that stand out to you about how families figured it out? It follows a pretty regular pattern.
There is several types of regular patterns. The type of kindergartner who's already had problems in preschool, the kindergarten teacher talks to the parents with concerns, and the parents come right in. They're losing it because the kid is running in front of cars and jumping off the swing and always forgetting to go brush the teeth or whatever. Those kids get identified very young, and parents are usually wanting to do something because they see it as a problem.
Safety.
Right. Then there are the kids who I see year after year. I have little notes to self that I keep in a what's called problem list of concerns the parents have, or just the things I notice that I want to remember next year when I see them for their well visit. There are many kids who year after year, I will bring up things that I notice that might be problematic, but these kids, parents deny problems. They say the teacher doesn't have any concerns because the teacher's never reached out. They say the kid has good grades, so it's not a problem. Eventually, these are the kids who parents call because they're suicidal or severely anxious or something. At some point, many of these kids that have those symptoms that go unidentified, they will struggle because ignoring the symptoms leads to anxiety, depression, drug use, low self-esteem.
Put the chill up my back to hear that, because it just seems if the parents, you just could change their frame of reference, it would make such a huge difference. I know that's what you and I are committed to, getting them educated so they have a different view of it.
Yeah, that is one of the things that breaks my heart. They could have been done.
Is there a third scenario or just mostly those two?
There's also the ones that parents probably know that there's a diagnosis, but one or both parents are afraid of medication. They want to do everything but medication. They put kids on restrictive diets, special therapies, put them in taekwondo or whatever to treat in another way. Sometimes that's enough. Sometimes you can do okay. But I see so many kids that aren't identified and end up struggling. We know from Dr. Barkley's research, there's a shortened lifespan if she's not treated. It's a significant problem, even if they look good on the outside. If they're masking, you can only do that so long before they break. So that's what your whole thing is. Find the girls, find the kids that aren't identified.
The thing about the medication, that's so important to get everyone on the same page, because it just causes more dissension and stress in a family that already has it, and that puts it on top of it. We recommend that parents pursue structure. They pursue exercise, nutrition, sleep. They don't pursue the wacky things. They don't pursue the things that are going to cost a lot of money and there's no research to back it up. They pursue these things that we know are helpful in all cases. If that isn't enough, that's when they should go consider treatment with medication. There are other things to put in place as well, but not to rule out medication.
It does come with complications and side effects, so definitely needs to be followed up on a regular basis with the prescriber, but definitely medications have a place. I am very worried. Medications might be more difficult to come by. We've struggled with the past several years with the shortages. I'm not a therapist, but I'm very pro-therapy. Therapy can change the brain. If you do the right therapy, like cognitive behavioral therapy, not just talk therapy or play therapy, but if you do the right type of therapy, it can change the brain. It can change the way you think, which changes the way you feel, which changes your actions. The science shows that therapy can change the brain and make permanent changes for good. Whereas medications can help open your mind to allow you to learn the therapy tools that you need. But it doesn't permanently change your brain. If you take your medication for depression or anxiety and then you stop it, if you didn't do the therapy too, you're not going to get better.
The medication allows you to learn the new skills more easily. But once you have the new skills down, you can often let go of the medication. That's been how my situation in my life. You just force yourself to keep up your habits.
Yeah. I wish that more people would understand that you need both, because there are people who only want to do medicine because the pill is easy. And there are people who only want to do behavior lifestyle changes, but they need the medications. We need to support all avenues of helping. And of course, going back to the basics of getting enough sleep. In this country, most people don't get enough sleep. We are horrible to our teenagers because we start school too early. We know the science that shows that they need to sleep in, and yet we make them get up. They have practice sometimes at 5 a.m. this time of year because it gets too hot later in the day. It's ridiculous. Their brains cannot function that way. They need exercise, but they don't need to do it at that time of day. They need healthy nutrition, but healthy nutrition is not going to fix a brain basis thing.
Any other words of wisdom for anyone listening to this interview?
I don't have the big secret thing. Live healthy habits, need to learn skills, and people need medication to help bring it all together. People with ADHD don't always outgrow the need for medication. When I was in training, it was felt that adults wouldn't need it anymore, and now it's recognized that adults still need the medication to help their brain focus.
Yeah.
I probably have medicated with caffeine all my life. I'm not taking medication, but I definitely use caffeine. Without it, I struggle. I am medicated, just not with a prescription, which is not necessarily the best thing.
I should have written down what was it I wanted to ask. That's an ADHD issue is if you don't get it when you have it, it might be gone forever.
That's why so many people interrupt if they have ADHD. They're afraid they're going to forget it.
Yes.
Or I repeat it in my head several times, then I miss what somebody said. There's no best way. You have to write it down.
Thank you.
Thanks for having me on. Thank you.
Bye-bye.
Bye.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.